Morning. Welcome, sir.
Thank you. Do you have the lunch roll?
COVID-19 began multiple safe and effective vaccines.
التي بذلتها كل من فرنسا استثمرت فيها مصر على مدار السنوات الماضية.
For many countries. As African heads of state, vaccines were sourced from outside our continent, despite Africa accounting.
And also a strong commitment from all.
Tunisia, Nigeria, Senegal, and Egypt.
In April last year, WHO issued a call for expressions of interest for establishing a technology transfer hub for mRNA vaccines. The aim of the hub is to provide a facility where manufacturers from low and lower middle income countries can receive training in how to produce certain vaccines and the licenses to do so. I'm delighted to announce the first 6 African countries that will receive technology from the hub to produce their own mRNA vaccines: Egypt, Kenya, Nigeria, Senegal, South Africa, and Tunisia. WHO will work with the companies and the government in each country to develop a roadmap for training and production based on their needs and capacities.
Kenya is truly honored today to be listed as one of the beneficiary countries of the mRNA Technology Transfer Program, and this is indeed a testament to the caliber of the scientists present within our institutions across our region and indeed the entire African continent. This announcement also announces and demonstrates the power of partnership to change the trajectory of Africa's health security for the better. Therefore, today's event is without a doubt an immense and of historic significance. The Technology Transfer Program, once successfully implemented, will without doubt set Africa on a sustainable path of self-sufficiency in terms of vaccine supply. Let me also say that it is my fervent desire that this collaboration will be explored also in other areas such as the manufacture of medical devices, biosimilars, and other emerging areas of biomedical research.